Hi, everyone. We are going to get started here in just a minute. Even though it's July 8th, we thought, well, we're talking about storage and handling and how to keep vaccines safe in your refrigerator. So we have a cold theme, but this doesn't mean that we're saying go freeze your vaccines that aren't supposed to be frozen, right? But Macrina said Lifetime is doing Christmas in July. So,
Yep.
so I guess Tips is too.
Right.
Yeah. We are going to get started in just a minute here. I'm going to shoot a quick text over to our guest speaker here. All right. Well, I think while we're waiting in, if you could all chat in, and it looks like most of you are already doing this, but chat in the names and the credentials of the people who are with you. This is just so that we know how many people we're reaching. And we're seeing, again, lots of familiar names. So well, maybe we'll get started and maybe just switch things around a little bit if our special guest comes a little late. So my name's Rebecca Nevadale. And Macrina, do you want to say hi?
Hi, I'm Macrina Leach. How are y'all doing?
Good. So we're here on behalf of TAPI, and we are your state vaccine coalition. This is our third virtual tip, so we're really excited to be here and happy to partner with the Arizona Telemedicine Program and HRSA-funded Southwest Telehealth Resource Centers to do this virtually. We miss all of you in person, but are just really thankful that we get to still provide this education and see all of your familiar names and have time to just thank you for everything that you're doing right now. Things have continued to just become more and more surreal in our lives, and you are doing a lot of work to educate your patients about how to stay healthy during the pandemic, but also just work to make sure that we don't worsen the pandemic with outbreaks of vaccine preventable diseases. So we know that your day-to-day lives have changed drastically, and really just want to thank you for everything that you're doing and for taking an hour to spend with us on our tips training. So one way that we've been thanking you is to send prizes through the mail for folks who participate in our evaluation. So I'm going to spin our wheel here. So Talea Saburin, we will send you a prize. Thanks for filling out our evaluation. And Cordelia Gorman gets a prize too. So it's fun to spin the wheel, isn't it? I like our wheel. All right, so Macrina and I are coming from our homes today. We have quite a packed agenda. We're going to talk about storage and handling and also about preparing for your patients. We're going to do a brief COVID update. And Peggy Stemler is back again. And if you want to chat your questions about COVID now, she'll be able to read them when it's her turn to speak. Peggy is not going to be able to stay on after for our 15 minutes of Q&A because we're going to keep the line open from 1 to 1:15. So go ahead and chat those in now. And we're also going to talk a little bit about preparing for flu season. And we're waiting for our guest to come on for that. So let me stop sharing my screen for a minute here and just check and see if he sent me an email personally. Oh, I don't think so. Well, why don't we, Peggy, can we start with our COVID update?
You bet.
All right.
So I don't have a lot of pictures today for you guys, but if you want to just show just 2 pictures on the slides today, you want me to pop them up, Beck?
I can share them.
Oh, there it is. Okay, so this is the first one. This is Johns Hopkins University has all these like graphs that they show. They have a website with all kinds of data, both across the world and US. And this particular color-coded map of the United States is a map of the rates of COVID by county in the US. And of course, in Arizona, we have not that many counties, so the big chunks are bigger. But you can see that in Arizona, we are pretty dark red all across the board. And that's actually different than last week. And it's really different from 2 weeks ago when we last got together and talked. When we're talking about rates per 100,000, what that does is it takes places in the country that have smaller populations and places that have bigger populations and kind of makes a way to make that equal in terms of how much COVID is going on in the community. So hopefully that makes sense. We know that this, and this is across from the very get-go, by the way. We know that this started like in Washington state and in the northeast of the US, and it has sort of spread down through the southeast and in Texas, and Texas and Arizona, Florida right now are really some of the places that are kind of most challenged. So on the next slide, that is looking at what it looks like in Arizona today. This is data from the ADHS website, and it is the 2 graphs, the 2 maps. One of them is the what's called the absolute numbers, the case counts, and that is from the beginning of COVID, how many positive cases have come out. And on the right-hand side is a little bit of a different coloring because we can adjust the colors in Arizona to give a little bit more visibility to the differences in the population rates here. And still, not surprisingly, we still have the hottest of hotspots in the northeast of the state, Navajo and Apache counties, in Yuma County and in Santa Cruz County. And those border counties, one of the things that happens in those border counties that is that U.S. citizens who had been living in Mexico have been coming back across. This is actually the Kaiser Health News had a nice article describing the impact of some of that, because these case numbers only count county residents. So I think that that's just another piece of thing. So each county has their own people. Whether you were visiting somewhere and got sick there, your case will count where you live. So we are past 100,000 in those number of cases overall. And the health department counts both what's called confirmed, which is that PCR genetic material of the virus test. And then they count probable, which is a lot of different things that feed into that, but there's some really specific definitions that come out of CDC that go into that number. So it's not just random. There are several different ways that you come in as a probable. And one of the questions that came up last time is, well, what about somebody who's had 5, 10, 20 tests? Do they show up, all of those tests show up in the numbers? And the answer is no. There's a lot of work that goes on the back end to match the tests with one person. But in those case counts, that's all one, it's 108,614 individual human beings that have tested positive or have probable COVID-19. We have we're closing in on 2,000 deaths in Arizona. And again, one of the things that you're probably hearing a lot of talk about in the news is, well, is this just all due to an increase in testing? And I think we talked about this a little bit last time, but just to say it again, because it's all worth saying that, yeah, test rates are going up and they need to go up a lot more. And, but the percent of the tests that happen are coming up positive more often. So back in early May, 5% of all of the PCR, the genetic material tests, that virus genetic material tests that were taken, 5% of all of the tests were coming up positive, and now we're close to about 20% and north of that. So yes, more tests, but yes, more of the tests that are being taken are coming back positive. And that's another, you know, just if people are asking you or saying, well, it's just due to all the testing, the answer is no, that's not it. So the other thing that's kind of scary is that across the state, of all those 108,000 cases, more than 30,000, which is almost 30% of them, have been this past week. In Maricopa County, in the past 2 weeks, that's half of all the cases have come in the last 2 weeks. So we are in a little bit of a hot spot and continuing to work with that. So should I keep going, or do we have Dr. Bob?
We do have them on, but there's a couple of questions that came in on the chat. One from Blanca is wondering, once you get better from COVID, will you get it again later?
Yeah, Blanca and everybody, I think that's a great question. And I think this is one of the biggest challenges with COVID is, you know, at some level we have some kind of insight into the answer to that because it's in a family of viruses that also have things like the common cold, but we're also in previous much more contained epidemics. SARS was one of them. So coronaviruses in general, you can get, it's like flu, variations on a theme. We don't know yet reliably for this particular coronavirus infection, the SARS-CoV-2 one, or as we call it, COVID-19, because it's the 2019 version, because it started in January. So we don't have that way of looking back to see what happens over time. So as with many things with this thing, we're learning on the ground, but there is a likelihood just based on the fact that, you know, coronaviruses, other colds, just like flu, you have some immunity, but it may not be 100%. But we will learn over time. And Dr. Bob may chime in on that as well when he speaks up.
I don't know. Can you guys hear me?
Yeah, we hear you
now.
Oh, phew. Okay. Sorry about that.
So, what do you think about that? So maybe I'll.
So go ahead, keep going, and I'll chime in.
Well, I think that, Peggy, if you could answer the other questions about COVID in the chat, and then we'll go ahead and make sure that we copy and paste those answers so that everyone can read them. But now that Dr. Bob is on, you know, we've heard a lot, Dr. Bob, and I want to make sure that you can speak to that question too of will we get COVID again? But we've been doing these tips trainings virtually for the last few weeks, and we keep telling them, Macrina keeps saying, you guys really need to get ready for flu. You really need to get ready for flu season. And we're getting questions from our MAs and our nurses saying, well, what does COVID have to do with flu? So that's why we invited Dr. Bob to present to all of you and just talk a little about why this flu season's different. He is more passionate about flu than any other person we know.
Yeah.
The most recently was the interim director down in Pima County. So yeah, Dr. Bob, say hi. And we have a picture of you. That's our picture of you.
Oh dear, I hope it's a cartoon. But
it's one that you drew of yourself.
Oh, excellent. All right. So here's the deal with flu, and this is what drives me crazy a lot. I mean, we're really going through it right now with the COVID-19 pandemic, and there's no denying that this thing is worse than the flu, but it is not out of the park worse than the flu so far. If you look at the number of people who died a couple of years ago in this country from the flu, 60 or 80,000 perhaps, and you compare that to the number of coronavirus deaths that we've dealt with so far, we still haven't even doubled what we have from some regular flu seasons. And yet for this thing, we basically shut society down and ruined a lot of people's livelihoods and lives. And for flu, we can't seem to get people motivated to go out and get a simple shot. And we know that we can, with flu vaccine, even though it's not the world's greatest vaccine, we can get enough people immune to create herd immunity against the flu and take at least 90% of the flu cases away each year. So that's one thing, is that the flu is a big deal, and we don't give it the attention it deserves. The other thing, this year particularly, we're going to see COVID for a long time to come, even if we had gotten bailed out somewhat over the summer by the hot summer months, and it certainly isn't happening. But even if we had, we knew it was going to be back in the fall and winter with a vengeance. And, you know, the last freaking thing in the world you want to have happen is a simultaneous bad flu season and this happening at the same time. Not only will that worsen the overtaxation of hospitals and the healthcare system in general, but you really don't want to be sick and not know what you have and have to go sit in a waiting room of a busy urgent care or emergency room while we've got COVID raging and the numbers again surging. So this is a particular concern this year. We've got to do everything we can to keep flu numbers down so that it doesn't make things that much worse for dealing with COVID. And on top of it, if you think about what time of year people usually go out and get their flu shots, you know, September, October, hopefully sometimes November. If we've got COVID still circulating a lot of people, especially the folks who are at highest risk from complications of both the flu and COVID, are going to be afraid to go to those places where they usually get their flu shots. So this year, more than any other, we can't miss a single opportunity to get somebody a flu shot when you've got them in front of you, because it's going to make a huge difference come December, January.
Is there anything
what else?
Is there anything else, Dr. Bob, you'd tell the healthcare workers to do? I heard you say no missed opportunities. Every patient that's in front of you should be offered a flu shot. Anything else you think they should be doing?
Yeah, getting their own for sure. That's important every season, because you don't want to be right in the face of somebody who's most vulnerable and accidentally transmit the flu. But also, you know, if we're lucky, it's a weird way to look at it, but sort of a silver lining of all the social mitigation. All the social mitigation from COVID is not going away. Many of us said from the beginning that if the officials who are making the decisions really wanted to close businesses, close schools, and so forth, they were going to have to be prepared to do it for the duration of the outbreak, or when they reopened, it would just come right back. And much of what we've done may be the worst of both worlds. I mean, we kind of took on the economic consequences first, and then reopened so quickly that we may be facing the same wave and the same peak number of cases that we would have if we'd never done that closing down of the economy in the first place. So we're looking at reaping the worst of both potentially here. But if there's a silver lining, it might be that if we're still in social mitigation, that obviously will help cut down on transmission, not just of COVID, but of flu as well.
Absolutely.
So
we're getting lots of people are happy to hear you and saying nice things about you in our chat. So I think you're already missed in Pima County.
all right, sweet. Thank you, guys.
Yeah, and I'm
miss you
seeing a
too.
lot of other questions about flu. It really, we wanted you to come on because we just know you love, well, you don't love flu so much. Macrina's already corrected me that we don't have favorite diseases, but
We have favorite vaccines.
we have favorite vaccines. And I think it's safe to say that would be one of his.
Yeah,
One of
yeah.
yours.
It frustrates me to no end that, and look, I know people complain about flu vaccine. I know that its efficacy varies from year to year depending on how well they matched the strains in the vaccine to the strains that wind up circulating. I know that people complain about side effects, which honestly studies, I'm sure it happens sometimes to some people. And I know all of that, but flu is god awful. It's, what we're dealing with COVID is significantly worse, but the proportionate response difference between the flu and COVID, I think it's just that people are so, accustomed to a flu season that they stop paying attention. But boy, it's a big deal.
Mm-hmm.
And hopefully people who've gone through COVID will come out the other side with immunity that will last a while, but probably not forever. I mean, our immunity to other coronaviruses seems to protect us for a few years, perhaps 2-3 years. But then we can get infected with another coronavirus cold. So I would be surprised if we didn't see the same kind of phenomenon here where we get, you're probably not going to get it twice in the same season. But, 2-3 years down the road, you may. And that bodes really poorly for us for the long term, by the way, guys. COVID, if it becomes a seasonal disease, this thing may come back around every cold and flu season. So we got to be prepared to, at the very least, make sure we can control what we can control. And flu vaccine is one way of controlling what we do have the most control over.
There's so much that feels like we can't control in our personal lives and at work, for those of us who work in public health and those of you who care for patients. So I think that it's great to have you on and just to remind us that there is something that we can all do by really spending the time to talk with patients about their concerns about the flu vaccine. And Chris, I'd love if you could launch that poll that has flu. We're curious, what are your practices? What do you expect that you're going to do this year? And you can select everything that applies to immunize your patients for flu. There's a lot of options there. And if you have other ideas, go ahead and chat them in. We're getting some questions in the chat about when can you order flu vaccine, and Is there going to be back order and things like that? We're going to make sure that we respond to as much as everything that we know about. And if we don't know the answer, we'll certainly find it for you. But Dr. Bob,
and you
can stay on, but
you guys should be, you should be aware that there's some other stuff happening with flu vaccine this coming season too, just so you know it's there in the background. I know pharmacies have ordered more than usual. I know there are different organizations planning to do different flu shot campaigns. Pima County, we entered into a contract with a mass immunizer, hoping to do as many as 100,000 additional shots in the year. But despite all of that, a lot of people are going to be afraid to show up at those kind of mass events. So you just don't miss an opportunity when you got it this time around. Yeah, you were saying.
thanks so much. Yeah.
I interrupted you, Rebecca.
Oh, no. Well, you know me, Dr. Bob. I'd never interrupt anybody.
Me either.
If you can stay on, we'd love to have you on, but we know that you're really busy. But come back to any tips training. We'd love to hear from you. And it looks like you're missed, always been missed in Maricopa, but now Pima County's really chatting in that they love you. So
that's really, everybody. I got so many positive comments and thank yous from the people down in Pima County. I was just the face of a lot of people working unbelievably hard. And so I got a lot more credit than I deserve, I think. But having said that, we aren't the ones taking care of. I mean, I was incredibly stressed, and people in public health we were flying all over the place, and we were incredibly stressed. But we don't have the stress of having to take care of patients and donning PPE, hoping not to get exposed, and dealing with the shortage of PPE that so many of the people on this call were having to deal with. And you guys are my heroes, I got to tell you. So with that.
We sure agree with him. So there's definitely, it's interesting to see the results from this poll. It looks like most of you are doing, there's 6% of you who say this question is stressing you out, that your practice hasn't talked about what you're going to do. But it looks like a lot of people are planning on offering at well visits and sick visits, which remember, we want to give flu at sick visits as well, right, Macrina?
Yeah, we want to get flu anytime we possibly can. I think the goal of everybody in the state of Arizona is that if you want a flu shot, you're going to be able to get one. And if you don't want a flu shot, you're going to have somebody telling you should get a flu shot.
Yes. And it looks like some people are still doing your traditional flu clinics and planning right now to allow walk-in flu immunization. Some are looking at how to do drive-through clinics. As much as, we're so glad to see that you're thinking about this at all. And if there's anything that Chappie can do as you're thinking through it to help connect you with other practices who are looking into similar things, please reach out to us and let us know. We all need to really do our best to get flu in arms this year. So, but we should probably move on to storage and handling here. We're going to talk about storage and handling today, the cold chain management, keeping vaccines safe, and then what are the things that you have to do to prepare for your patients before you can walk into the exam room with that immunization. So this is just a brief video that kind of helps set the tone for what is the cold chain.
Manger ali. Vou quitter não? Parce que je n'ai pas un peu. Oui, c'est lui-même.
Well, we really like that because it just helps remind us that vaccines are needed. There is not enough vaccine in the world for us to waste any, or to have, even though accidents happen, we've all experienced shortages, and there's people around the world that are working to protect that cold chain and to bring these immunizations to people who really need them. So, um, the Macrina, can you tell us what is the cold chain? Remind us. Oh, and you're on mute, it looks like.
There we go. Okay, so the cold chain is really everybody's responsibility, but it's really how vaccines, you need to maintain the appropriate temperature and handling of them. And it really starts from the beginning of the manufacturer and goes all the way down to the MA or the nurse who's in that exam room giving a vaccine. It's like anything else, you need to make sure that it's stored at proper temperatures to make sure that it continues to be effective. And really, it's everybody's responsibility when it comes to vaccine storage and handling in the cold chain. Everyone should receive training. You should definitely have your primary and secondary contact identified in your office, and they should take yearly training. I really recommend everybody who administers vaccine or has any responsibility for vaccine take the training. That way, you know at least the basics of the storage and handling and how it needs to be taken care of. And there's a lot of opportunities and a lot of different trainings out there. So, and they're all online, and they can be anywhere from 30 to 45 minutes, so they don't take a lot of time.
So CDC recommends that everyone receive training at their anyone who's going to have anything to do with vaccines receives training at their new employee orientation, at least annually, every time there's a new vaccine added to the schedule, and every time that the recommendations changed. And all those things kind of happen quite a lot.
Quite a lot. And you should also make sure that you keep track. Whoever's responsibility it is to make sure that staff has up-to-date training, you should always keep track of what staff have been trained, who was trained, and what training they took. And that's really important.
All right.
Okay. So here's a picture of, I'm sure your refrigerators in the office and your vaccine storage temp monitoring equipment. You definitely need to make sure that you store vaccines in 2 different units. One is a refrigerator, and that temperature is between 36 and 46 degrees Fahrenheit. And that's the majority of your vaccines are stored there. As you see, you store them in the middle of the shelf. The middle shelves, you don't store them on the top, for fear that that's routinely where the blower is in your refrigerator, so you could end up freezing them. You don't store them in the door because as you open and close that refrigerator, there's a really good chance that temperature is not really stable there. You keep water bottles in there as well, because if you do have any electricity issues, or your refrigerator goes out, it does give you some time because it will allow to maintain that temperature of your refrigerator. Freezer, you are going to keep that between -58 and +5 degrees Fahrenheit, or -50, -15 Celsius. Again, you're going to put vaccines in the middle of the shelf. Primarily, you must freeze your you must freeze your ProQuad, your MMR Varicella combination, and your Varicella vaccine. Most people will store their Varicella in the freezer. Routinely, it's more of a space issue. And I need to tell you, I flippin' hate this picture, but I can't find another one. I recommend you use Fahrenheit or Celsius. You don't go back and forth. I think that can cause confusion.
So just make sure all of the folks in your practice are all doing the same, using the same measurement, either Fahrenheit or Celsius.
Right, make sure it's all the same. Make sure that you document on the front of that unit that the refrigerator should be between 36 and 46 degrees and that the freezer should be between -58 and +5 Fahrenheit. That's a really good reminder every time you go to that refrigerator, if you look at the thermometer, that those are the temperatures it should be.
And are they supposed to write "do not drink" on the water bottles too?
Yes, those water bottles are not for drinking. And you could put "do not drink." We kind of tie a ribbon around them, knowing that then you can't take the bottles. Whatever works for your facility. You always want to make sure you have an emergency vaccine storage and handling and transport plan. You need to make sure that you have ice chest, you have extra data loggers, you, just in case you need to transport vaccine in case of an emergency. You can find, I believe we've attached a copy of emergency transport of vaccine as a handout. You can also find them on the CDC and the ADHS website. Again, you always hope for the best, but you plan for the worst because you want to be able to have a plan to move that vaccine if you have to.
So did you say that, going back to that other slide, we have a question from Julia saying, varicella can be kept in the fridge?
No, varicella must be frozen.
Okay.
Varicella must be frozen. Your ProQuad must be frozen.
And the reason why we use bottled water instead of the ice packs is?
For transport or in
the fridge.
Units. Oh, we use them in the units because, well, first of all, you don't want to put ice packs in the refrigerator, but you use them in the freezer because they maintain the best temperature.
Okay. Thank you. Yeah, so for their emergency plans, that everybody needs to make sure that they have one written down, right? And that that there are backups listed in the event of a power outage, in the event of evacuation because of fire.
Right. Every community has their own challenges with the environment, whether it's monsoons and electrical outages or fires. Some poor communities have multiple issues, but you always want to make sure you have a backup, someplace you can transport that vaccine to in case you do have an emergency.
And the most important thing, if you have to transport, is what?
The most important thing to remember if you have to transport is you must put a data logger in the ice chest. I think that's probably the most common mistake that folks make with transporting vaccine in an emergency. And having had to pack vaccine up in an emergency and transport vaccine, all you're thinking about is packing it safely, making sure you get the ice packs in there and getting it packed properly so the vaccine's protected, but you've got to have that data logger to document the temperature while in transport.
Great. So Chris, can you launch the next poll, the error poll? We know that you've all seen lots of errors, storage and handling errors in your practice. Mistakes aren't bad. It's bad if you don't tell anyone about them and if you don't fix them. But mistakes it's okay to make them.
Mistakes happen, and the whole idea is to make sure to be honest about it and then come up with a plan so it doesn't happen again. Mistake only becomes a big problem is if you keep it to yourself and you continue to make the same one over and over.
Yeah. What's one that you see a lot?
Well, I think the two most common that we see a lot is, number one, is that when you document the temperature twice a day, that we see that people will document temperatures that are outside the safe range. We've seen temperature logs that will have 48 degrees posted 4 or 5 days in a row. sometimes things become so routine that you don't really pay attention. You just do it. You don't really pay attention to why you're doing it. That's why I always recommend put a big sign on that refrigerator that says, these are the temperatures. And number two, I think the biggest one is when you unpack that Varicella, that MMR, and that ProQuad, make sure that the vaccine goes in the freezer, the diluent goes on the shelf. Because again, sometimes you're in such a hurry to get it unpacked and make sure it gets where it needs to go. I've seen vaccine on the shelf and diluent in the freezer, just
Right.
like that.
So it looks like the most common error that our folks that are calling in today have seen is not using vaccine with the soonest expiration date first. So
Yes.
how can they do that?
And that is actually one of the problems we see as well, is that you just need to make sure that whoever is responsible for vaccine, your primary contact, is that you make sure that the shortest dated vaccine is up front, and that as you go back, you get to the longer expiration dates. That is probably the third most common one we see happening.
And you want, if a vaccine, another person had chatted in, what happens if you give an expired dose if it's expired for just 1 day?
It's an expired vaccine. You need to report it, and you also need to bring the patient back.
Another common one is vaccines left unattended on the counter. I have to tell you, probably at least 5 times, we have come home from a TIPS roadshow and gotten an email the next morning from someone who said, so yesterday we had a vaccine delivery. I wasn't there and they left it. It was there this morning on the counter, or they didn't put it away properly. So I know that we've heard that a lot.
We've heard that. Yep.
But if you're doing the training, if everyone in your office who has anything to do with vaccines, and that means who is able and to sign for the package, right? I mean, one intervention people have tried.
And I always recommend that somebody at the front desk, whoever is responsible for signing packages and checking them in wherever you are, they also take the training. Because that is really helpful, because if that package does arrive and they're the only ones there right now, then they're going to know to be able to at least unpack it, do an inventory, and get it into the proper units to make sure it remains safe and viable.
Right.
Because that's a sinking feeling to come in the next morning and find that package sitting under the desk.
Another common one is not having backups. So they have the VFC coordinator, probably also usually manages the vaccines for the non-VFC eligible patients, the grown-ups, and your privately insured kids. But yeah, you need a backup. I mean, you have to be able to go on vacation. You have to be able to win the Powerball and not show up anymore. So we really need to make sure that you have that. And this is all, why these standard operating procedures are so important.
Right. Always have a procedure. The vaccine operations guide from ADHS is pretty big. Always have that on hand, but always have a storage and handling procedure, checklist, job action sheet, whatever you want to call it, for both your primary, your backup, and then additional staff. And that way, you have an easy checklist to go through, and you know that the vaccine will be taken care of. And
no, the VFC operations guide, we did get a question. So VFC is vaccines for children. So this is for children who are covered by Medicaid in our state, or uninsured, or are tribal members, or are underinsured.
Underinsured. Yeah.
Their insurance doesn't cover any vaccine. And so those of you who care for just adults, that's why you don't know what it is. But they do have a ton of resources. If the VFC Ops Guide, all of that's relevant. A vaccine is vaccine, right?
Vaccine is vaccine. It doesn't, a Tdap, an MMR, meningococcal vaccine, they all have the same rules for storage and handling and administration, whether it's privately purchased or whether it's VFC. It's just that VFC has some requirements that are specific to VFC and who you contact if you have issues, but the vaccine should be handled, stored, and taken care of the same way. and with the same importance.
Yeah, so if you're looking for a template for your own standard operating procedures, we'll send this out after the session. And you can use that and copy and paste. There's also a lot of resources on cdc.gov. You call the shots should be taken, that's the one we recommend you take annually, and they have a fabulous toolkit. We'll send some additional resources from CDC about storage and handling with your materials. So the big that we send after the session. So our big takeaways are staff training, clearly defined roles and duties in your standard operating procedures. Make sure that there's primary and secondary person there. And we want to follow these procedures to reduce errors and reduce waste. You do not want to have to call back in people who were given an expired vaccine, especially when you've already spent all that time, partnering with that family and answering all those questions. You don't want to have to do that twice. And
yeah, and I always think about this as it's very complicated. You get them in for vaccines, and you do the screening. When you administer a lot of vaccines, and then you make the parent feel really comfortable that even though their child is crying and screaming right now, that they did the right thing. The last thing you want to do is call them back the next day to say that you need to do it all over again because the vaccine wasn't viable. It's an awful, awful feeling.
So the other thing you need to do is actually read your SOPs and follow them and come up with systems throughout your practice to be able to help you follow them. How are you going to make sure that those temps get checked twice a day? How can you make sure that everyone is using the same measurement, Celsius or Fahrenheit? What's the procedure, and who are the people that need to know it when vaccines arrives, that they need to unpack it? How do you make sure that when they stock the fridge that you rotate the vaccine so the ones that are going to expire the soonest are up front, and make sure that you have your emergency plan? And there's also a template, I think, in the ops guide for that too. So we have the vaccine has left the manufacturing and distribution centers. It has arrived at your office. It has gotten into the fridge. So right before administration, there's a couple things that you've already done probably to make sure to check on the immunization status of your patients. So are they due for vaccines? A lot of different ways that you can do this. And we know that practices look at immunization status throughout that whole process of well care and sick care. So maybe, you can, just to get your schedule populated, run a reminder recall to see who's due, for example, for flu shots or for follow-up for completion of different series. When a patient schedules, is the person who's scheduling that appointment looking at immunization status and telling them you're also due for this vaccine? Are you telling them to expect to receive a vaccine when you do your appointment reminders? When you do your chart prep the day before, are you looking to make sure at every patient to see what their immunization status is? We would love you to check ACIS and compare and update ACIS as well. So if you know that they received a vaccine that's in your EMR that for some reason never got over to ACIS, make sure you update that. And when patients check in, looking at their immunization status again and telling them, reminding that patient, you're going to get these shots today, so they're prepared. So those are different ways that you've looked at whether someone's due. But what is vaccine screening? So we're not screening whether it's due. We already know it's due. What are we screening for?
Well, here what we're screening for is to make sure that that the child is healthy and that is healthy enough to get immunized. We're going to screen for contraindications. We're going to screen for precautions. Are there any illnesses? Is the child feeling well today? Do they have any allergies? I mean, we're going to ask all those questions. I always use a screening checklist because I'm very chatty and I can be easily distracted. So if I make sure that I go through this checklist 1 through 12, then I make sure that I've asked all the appropriate questions. And just remember that if they answer yes to some of those questions, it may not necessarily pertain to the vaccine that they're getting today, but it's going to prompt you to maybe ask a few more questions.
So remind us, what is the difference between contraindication and precaution?
So a contraindication is an increased risk of a serious adverse reaction. And routinely, again, those would be if they have an immune deficiency disorder, if they're severe allergic reaction to a component of the vaccine, a severe reaction to a pertussis-containing vaccine. And then precautions, they may increase the risk of a serious reaction. They may not, and may compromise the ability to produce immunity. And those are a little bit more in the gray area and something the provider is probably gonna be involved in making that decision. But do not administer when there is a contraindication.
So, and you use the screening checklist at every visit where a vaccine is already ordered, or you know that it's a vaccine visit, not every single visit.
Correct. Only every single vaccine visit, and whether they're getting one vaccines or multiple vaccines. I always use screening checklist, and I use it every time they come in for vaccines.
Children and adults. We're showing the child one here, but you have one for adults too, right?
We have one for children and adults. Yep.
And we talked about what the permanent and temporary contraindications are last time, and Macrina just talked about them again, but you forgot to mention the 2 temporary contraindications for live vaccines.
Right, and there's 2. There is pregnancy and immunosuppression, and those are only for live vaccines, routinely or temporary. And with immunosuppression, routinely, you will know how long you need to withhold those live vaccines before administering.
Okay, so we now have we've scheduled our patient, the vaccine got into our office safely and into the refrigerator safely. At the same time, the patient scheduled their appointment, or we actively tried to get them to schedule their appointment. And we checked immunization status so that we knew if it was going to be a vaccine visit. Patient walks in the door for a vaccine visit. We've screened them for contraindications and precautions. So now we're going to talk about preparing to give a vaccine. And next, in 2 weeks, we're going to talk actually about administration. And that's when we'll talk a little bit more about consent and empowering patients and educating them. So, but let's pretend they've already consented and our Rockstar MAs have answered all their questions. What do they have to do before they can draw it up?
They have to wash their hands.
Wash our hands all the time.
Wash our hands all the time. But you always want to wash your hands prior to prepping the vaccine and in between clients. I always wash my hands when I go in to prep the vaccine. Then after I prep the vaccine, I wash my hands before I go into the room. And usually I try to wash my hands in front of the patient once I get into the room. I just think it looks good. Gloves are not required per OSHA. There's no requirement when administering vaccines to wear gloves. But do keep in mind that if your agency requires you to wear gloves, then you must wear gloves. And you must change gloves in between patients.
And for oral vaccines, do they wear gloves?
Yes.
Okay. And there have not been any changes with COVID related changes or not?
No, the requirement, gloves not being required haven't changed with COVID at all. The reason why you really wear gloves is it does provide some protection to the person administering vaccines, and we really want to protect them from blood contact. So if you do think that there will actually be blood contact, then you definitely need to wear gloves. But that's why we wear gloves. And also familiarize yourself with immunization, the devices you're actually using. OSHA does require that you use a safety device of some sort. So there's all sorts of them out there on the market. Just make yourself familiar. I have trouble with that word all day long, with whichever one you use. And also keep in mind that for pre-filled syringes, it may be a different safety device than if you are using a single dose vial. You're never going to recap a used needle ever. Make sure your sharps container is close by. You shouldn't have to cross the room to throw it away, to throw the syringe in the sharps container. Do not leave it sitting on the counter, on a tray. You give the vaccine, you put it in the sharps container immediately. And second of all, make sure you don't overfill the sharps container. That's my biggest point, is that sometimes folks overfill it. There's a line, fill it to that point, don't overfill it, because it puts you as the MA at risk for a needle stick. Don't overfill the sharps container. And the best way to avoid any vaccine administration errors, because the last thing you want to do is have to tell, after you've gone to all that work, tell the client or the mom that there was an error, is make sure you have the right patient. If you have a lot of multiple kids in a room or multiple kids at a visit, kids about 3 and older will know their birth date. Ask them for their birth date, ask them to repeat their name. Make sure you have the right vaccines. I always check them 3 times. I check them when I take them out of the refrigerator or freezer. I check them as I draw them up, and then I lay them on a tray that identifies each vaccine. And then as I'm giving the vaccines, I repeat back to the parent which one I'm giving. Right now, here's the DTaP polio. Make sure you have the timing correct, that the spacing is correct for each vaccines. Dosage, make sure you have the right dosage. If you do family health, then you may have both children and adults in your practice. For the most part, all vaccines are the same dosage for adults and children, except for Hep A and Hep B. So make sure you get the right vaccine, right route, whether it's sub-Q, IM, or oral. Some vaccines are meant to build an immune response given a particular way, so you don't want to give them the wrong way. The right site. Children 3 and younger, you want to, up to 3, you want to give them the vastus lateralis of the thighs, deltoid of older children and adults. You got to document, and there's a lot of documentation. You need the right vaccine, lot number, expiration date, the site, right, left, deltoid, sub-Q. You need to document the date the VIS, on the VIS, as well as the date the VIS was given. So there's a lot of documentation to do. And then you need to have the right response. I always find that, again, let parents know what to expect as normal possible side effects. There are normal possible side effects to vaccines, and the more you let parents know what to expect and what is normal and what most people have happen, then most parents know how to respond, and then they don't get nervous or scared that this is something abnormal or unique. And they just answer all their questions. Did I go too quickly on that one?
No, not at all. I kind of have to laugh all the time when you talk about right route, because we have had at TIPS sessions before people share with us that they somehow got syringes on oral vaccines. So make sure that the people in your office are properly trained as well on these 8 rights so that you can reduce errors too. So that's the rest of the content on Starry. I'm like a little distracted here. Dr. Bob messed me up by being late, I think, today. We'll blame him. So
Okay, works for me.
I did want to make sure that if we could launch that last poll that's called Next. We are going to stay on the line for 15 minutes. And our next session is July 22nd. We're going to talk about vaccine administration, but really focusing on what are the questions that you're asked in that exam room. So if you could read this and let us know which are the ones that you are most commonly asked that you want to make sure you get ideas about how to answer. And we can shape the presentation to make sure we address those. And if you have other things that you're asked all the time that aren't on this list, go ahead and chat that in. All right, well, and as soon as those slow down, Chris, if you want to show, I think people would be interested to see what their colleagues are hearing all of the time too. So I know that many of you are going to log off at 1. We're going to stay on for 15 minutes. We have lots of questions in the chat box that we're probably going to continue reading through. If you could make sure, those of you who have to log off, to take that evaluation and let us know what was helpful, what was not, so that we can make sure to improve how we provide this education next time. So this is interesting. It looks like they're getting a lot of, why do I get the flu shot? This flu shot, why get the flu shot when I never get the flu? We're asked all the time, but definitely probably talk about that. Too many too soon, and autism for sure. Cool, thanks, Chris. That's helpful to see. So let's move on and talk about look through these questions, Macrina. So Laura is wondering, when is the best time to recommend the flu vaccine?
As soon as you get the flu vaccine in your office, you start recommending and administering it.
There's a lot of questions about when are they going to get it too. Do you know?
So we heard from our manufacturer yesterday that it's going to be distributed earlier than later. So we actually think that offices need to be prepared, because we think we're going to start seeing vaccine arrive at the end of July, early August.
Okay. So Raina is asking, we have a hospital grade unit. Do we still need a log tag?
As long as you have something that monitors, as long as you have something that keeps track and saves the temperatures, then you're good. For instance, in Maricopa County, we don't use a data logger. We use a system somewhat like that, but it actually saves to a website for us. So as long as you have something that documents the time. The most important thing is that if you do have a temperature excursion, the first question that the manufacturer is going to ask you is, how long was the vaccine out of range? And the only way you're going to be able to answer that question is if you have a system that will actually document the temperature every 3 to 5 minutes.
So who would they contact then would they contact the manufacturer to make sure that, of the fridge, to make sure that those things happen? Should they contact VFC if they're VFC providers?
I would contact the manufacturer of the fridge. I would also contact VFC providers, contact VFC, because they can give you a list of either data loggers or systems that you can use.
And Nadia asked, what are your standards for using the new AccuVax machine? And I don't even know what that is. Do you?
I don't know what an AccuVax machine is.
Sorry, Nadia, we don't know what it is. Hopefully it was, let's hope that it was with Raina and it was a hospital grade fridge. When documenting the min and max on the temp logs for the previous day, would you document it for that morning or in the space provided for min and max for the previous day?
Oh, that's a good question. We normally document the min and max in the morning when we walk in. And so that would be, I don't even have the answer to that question. I think as long as you consistently document the min and max at the same time each day, then you would be fine.
All right, so we'll make sure of that,
Yeah,
but
we'll double check that.
as long as you're always doing things the same way, everyone's doing the same things the same ways, then you can explain it.
Right.
Menactra and Men-B, is it recommended to do both vaccines on the same day?
Yes, you can.
I know that we're not talking about, that's not about storage, but.
That's okay. No, we can give them on the same day.
Oh, looks like a few Banner folks have chatted in. Does Banner require gloves? So if Donna's on today, maybe she could let us know. If not, we will make sure to tell Donna Furlong to get message out to everybody about whether they do or not.
Yeah, I'm gonna throw it out there that probably you're better off to wear gloves until you know what your organization's policy is, because most organizations require gloves.
Well, makes sense. I mean, if I saw something bleed, like when I pick a scab, I don't know. It could be
Oh,
so
that,
confusing.
really? We're gonna talk about picking scabs? Ugh.
Picking scabs. Well,
Yeah,
hey, we're all friends here, right?
yeah, yeah.
How long?
They require gloves at Banner. That's what they're saying.
Okay. How long will a vaccine last after drawing it up?
So the answer to that question is I don't really know how long it'll last while it's drawn up, but once you draw it up, you must use it. If you don't use it immediately, you need to make sure it's well labeled and you use it as soon as possible. The MMR is only good for 30 minutes once you draw it up. That is one vaccine that once you draw it up, you have to use it within the 30 minutes.
Yeah, and if you aren't sure, contact the manufacturer, right, for another
Correct.
vaccine.
Yep.
I mean, the goal is obviously not to waste vaccines, but we also don't want to have to call patients back in for giving them ineffective vaccines.
Right.
Do you know where they can get trays that identify the vaccines?
Ours actually came from one of the vaccine manufacturers. It's pretty old and it doesn't actually have the name of the vaccines. We had to label them ourselves with the label maker. So I think we got them years ago. I don't know. I don't think there's actually anything out there that actually comes pre-labeled. You have to sort of get a label maker and label your own, but that's what we did.
Okay. All right. Where does the Active diluent go?
So any vaccine that comes with diluent in its box, it stays together. So the meningitis vaccine, Shingrix, the Hib vaccine, they all come contained in the same box, so you just leave them together. So they'll go refrigerated.
All right. And we want to keep the vaccines in the boxes that they come in.
Correct.
And if a fridge goes out, so there's a monsoon or something and a fridge goes out, what's the first thing that they should do?
So if a fridge goes out, the first thing that I do is I check with the whichever electric company to find out when the plan is to get it up and going and moving again. There's no need to move it out of the refrigerator immediately. If you packed it in your refrigerator correctly, it'll probably be good for a couple of hours as long as the temperature is good. You're just going to monitor the temperature and see when the electricity comes back on. If you start to worry that it's going to be longer than a couple of hours, then you definitely want to move that vaccine.
The other thing you want to do is keep the fridge shut.
Yes, thank you. Keep the fridge shut. You don't keep opening it up because it's just like your ice cream and milk. Your ice cream will stay frozen if you stop opening the freezer and checking it. It'll stay frozen for a while. So just like you do in your home refrigerator when you lose the electricity, don't keep opening it and check it. Leave it shut.
So treat all the other girls in your office like you do your kids. Close the fridge till you know what you want, right?
Correct.
But in that situation, you're not opening it at all because.
Correct, because routinely if the electricity is out, you don't have air conditioning and you don't have lights, so you're probably not administering vaccines.
Lisa has an interesting comment in the chat saying, she says, informing patients about possible side effects from vaccines right now with COVID-19 makes them not decide not to vaccinate at all. It's hard to educate when they're scared. And I think I saw a few other people saying that they've been experiencing more resistance too. So
I think if you can actually just get them into the office, I think a lot of what we see is that they're scared just to come in for fear there's going to be a crowd or they're going to be exposed. So I think once you can let them know and provide that education that you're doing everything you can to keep the clients safe, because you also want to keep the staff safe as well once you get them in. But then once they're in, it's all about, you know, routinely, what are the side effects routinely? A sore arm, maybe a slight fever. And this is July, where every day is going to be over 110. You always tell them to drink a lot of water. So I think a lot of it is just to kind of point out that these are just normal. I just want to let you know what to expect.
Well, and we'll talk next in 2 weeks a little bit more about putting that fear in perspective for
Right.
families that, I mean, people are just trying to, especially for your kids, you're just trying, you have a brand new baby, you don't want to break it. They're not trying to
Right.
stay difficult. They're trying to make the right decision. So putting that in perspective will be important. I did want to, Megan from ADHS says that in that the question about where do I put the min and max the previous day or that morning, that day.
Mm-hmm.
So for VFC, they say in the space for min max in the morning for the previous 24 hours.
Okay, good.
That's that. Yeah. Is it normal for Shingrix to hurt worse than other vaccines?
Oh boy, let me tell
People are really complaining.
you that story. I went out and got my Shingrix as soon as I could get my Shingrix, because I remember my mom having shingles and I was terrified of it. I got that first dose, and honestly, I'm a pretty tough person, but I was whiny all day long. I felt, as my grandma used to call it, punk. You know, you just didn't feel good. You didn't want to do anything. Your arm was really sore. So yes, it is significant in the normal, but those are normal side effects. The vaccine is working really hard to build an immune response. And this is a vaccine that can build a 95% immune response in someone who's 90. That is an incredible feat. So it's explain what's going to happen, explain it's perfectly normal. Everyone's going to go through it, but it beats the heck out of shingles.
Yeah. Where do we report when we give an expired vaccine?
I believe that now we report those vaccine errors are reported to VAERS, as well as you're going to report them through whatever policy or procedure you have in your office. And then you're going to need to contact the parent and let them know what happened.
Time frame between live vaccines and attenuated, but what's the time frame between vaccines again?
There is no time frame between attenuated and live vaccines. You can get a live vaccine today and get an attenuated anytime.
It's live and live.
It's
right?
live and live, and it's 4 weeks.
Okay.
Same day or 28 days apart.
There is some questions too about will there be flu shot and COVID-19, and if they're positive COVID, can they get flu shot? I haven't heard anything about any recommendations about that. Have you?
I haven't heard anything about the recommendations at all, but I think it would depend on the severity of your illness. We always say that we can administer vaccines with mild illness. So I guess it would depend a lot of times what's the severity of the person's COVID.
Mm-hmm. Yeah, and I think we might also, there's a lot of other questions about COVID vaccine. So maybe we'll give you a little bit of an update for that on our 5th session, because I think we'll have some time in there. So we have 1 more minute. So I'm gonna fire, can we use 1 milliliter syringe or always 3 milliliter?
It's up to you. It doesn't really matter the size of the syringe. The reason why we use 3 mils is because the barrel is larger, so it takes less time to inject. Does that make sense? So the smaller the barrel, the longer it takes. So sometimes I think actually giving vaccines is a speed event for all EMAs who have given a lot at one time. The quicker you're done, the better off you are.
Yeah.
But you can use either one.
Is it required to have water bottles in the fridge?
I believe that VFC requires it, but Megan's still on. Yeah.
Yeah.
Thank you, Megan.
Yeah.
Yes, it's
So it
required.
is required for VFC, and which probably means it's a good idea for all your vaccines, right? So this is about maintaining temperatures keeping the fridge at the right temperature in the event of the monsoon or the power outage. So just a good idea.
And the good idea about putting the water bottles on the top and the bottom shelf with a sign that says do not remove, it actually means that somebody's not accidentally going to put vaccine on the top or the bottom shelf. Again, in refrigerators, the top is usually where the blower is and more likely to freeze stuff. And freezing vaccine is the death of vaccine that should not be frozen. If it's a refrigerator vaccine, freezing it will kill it. There's nothing you can do. So that's the one thing you definitely do not want to do.
All right. Well, thank you all. Again, our Q&A was really
Correct,
busy,
not the MMR. I'm just answering a question.
but not the MMR. Correct.
Correct.
Yeah. So thank you all so much for joining us. We'll see you all in 2 weeks, and make sure you email us questions about vaccine administration. And we're going to close off now, and we'll see you in 2 weeks. So stay safe.
Thank you.